The next part of this course is working through assessing and taking care of acute injuries. So what this pencast is going to be about is an algorithm that helps you get through that. And as you can see, we're starting with this acute injury. So you have someone who's down, who needs help. And some of the first things we need to do is survey the scene. Make sure it's safe for us. You're not going to approach a scene unless it's safe for you. At the same time, you're going to be putting on your PPEs. And you're also going to be assessing patient, looking to see what might be wrong with them. Is it going to be something that needs immediate attention or not? And with that, we're also going to assess their responsiveness. Now, there's a couple of ways to do this. There's an acronym called AVPU, where we're checking for alertness. We're checking for alertness when they are prompted verbally. So let's say you approach a person and you say, "How you doing? You okay?" There's nothing. Maybe you yell at them, "Hey, can you hear me?" And that verbal prompting might be enough to wake them out of it. So that if we were writing that down as part of the documentation, you would say that they were alert to verbal prompting. The P would be if you have to apply a painful stimuli to get them to respond. So quite often we do a rubbing of the sternum or pinch their trapezius or something like that to see if that will bring them to a responsive state. And then the U, of course, is going to be unresponsive. No matter what you do, they're not coming to. Now, there's another scale that you can use, and is quite often used with EMTs, paramedics, and that's the Glasgow Coma Scale, GSC, and I'm going to post that on Brightspace so you can see what a GSC score is. We're looking at how they respond verbally, eyes, etc., and there's a number score that goes with this. The lower the number, the less responsive they are, the more emergent is your situation. Now, if we have an alert patient, we're going to continue our assessment in one way. If we have a VPU, or, they're not alert or it's taken them a little longer, there's some other things that we're going to do. And one of the very first things we're going to do is we're going to activate our EAP that we talked about in class last week. We want that emergency action plan moving forward. And also with this, we're going to check the vitals of our patient. And we start with the circulation, airway, and breathing. The CABs or ABCs that you would do if you're thinking about cardiac care. So circulation, we're testing to see if they have a pulse. And the area that you had to assess this week for your skills testing was your pulse is in the carotid artery, and that's usually the place where we're going to check. As we check for that circulation in the carotid artery, we are feeling for not just quantity, but quality as well. So remember that. Airway, in the A part, we're actually accessing an airway. And those of you who are CPR certified, you know that we have two ways of doing that. And I'll talk about this in class on Wednesday, where we can do a head tilt chin lift. Well, first of all, we're assessing it. So we want to make sure that they do have an airway that's freely moving. And so you have your head down, listening, listening, feeling. The A and B kind of go together. Breathing would be that. Looking for rise and fall of the chest, feeling and listening for that movement of breath. So you'd have your head close to your ear close to their face. If they're not having any movement, we would access the airway using one of those two things that I was just starting to talk to you about. And one of those would be the head tilt chin lift. Again, like I said, I'll show you in class on Wednesday for those of you who aren't familiar. We could also use something called a jaw thrust. The jaw thrust is used if you suspect a head or spinal cord injury, so that we're not moving the head and neck and making someone worse. From the CABs, you would perform any care that you needed to, and that might be CPR, AED. It could be rescue breathing, Gracie, stop. But let's say that this is fine, that the CABs are normal. What we could do then would be to continue with our eval. So we assume now that we can move on. Some of the things that we want to look at. Oopsie, my pen's not working. Hold on. Here we go. We're going to do more of an assessment, especially if we have some responsiveness of our patient. Something called an S times 3. And with S times 3, one of them is going to be, we're going to check and treat for shock. Another S is going to be looking for and treating severe bleeding. And the last one, S, is going to be to check and care for a spinal injury. All right, so if we're looking at shock, you guys need to know the signs and symptoms of that. So make sure you're looking that up in your Anderson textbook and making a nice little flow chart of that so you can see the signs and symptoms of shock. For severe bleeding, we're looking and feeling for any severe bleeding. And then for spinal injury, I'll teach you how to do that, but we're going to look for any abnormal palpations, and we'll do spinal palpations this week. And we're also going to do a very quick assessment. It's called a CSM. Sometimes it's CMS, where we are checking right here, sensation and motor. And that's when we're going to ask them to wiggle their fingers and squeeze your hands, and we're also going to ask them to move their feet up and down and to push against your hands. So that was going to be helping us to either rule in or rule out a spinal injury. If there's problems there, again, we have activated our EAP already, and we might need to help treat shock with keeping them warm or whatever. Severe bleeding by perhaps stopping the bleed, or a spinal injury by stabilizing the area and just waiting for EMS to arrive. With S times 3 after that, what we're looking at is a couple more assessments before EMS arrives. At this point, if EMS still hasn't arrived, what we're going to do is work on those vitals that you have been practicing, if you haven't done them yet, with your patient. And so one of the key vitals that we need to check is blood pressure. Blood pressure is going to give you an indication of what might be going on there and the severity of injury. So you're going to check blood pressure, pulses, respiration, Pearl, if we can. Depending on the situation, you might be doing a pulse ox. And again, depending on the situation, you might do core temp, but you definitely need to assess skin temp and color, because that's going to give us an idea of what might be going on as well, skin temp and color. All right, and by then, hopefully we've got EMS there, and you're going to hand off to EMS. And you also will probably need to document your findings. Now, documentation, we're going to use a different format for that. We talked about earlier doing the SOAP or the HOPS format, but a very common documentation that's used amongst EMT and paramedics and the ED at the hospital is a format called iChart. So I'm going to post a website for you to look at that. It just gives you a really nice flow of how to write up what you saw and what you did for that patient. We are going to hold off on the alert side until I see you in class on Wednesday. So start to get a handle on if a person is not responsive or responsive only to a verbal, painful stimuli, what are we going to do? All right.